The pain starts as a dull throb in your upper jaw on a Tuesday. By Friday, the grid is down, the pharmacies are looted, and that throb is now a screaming, hot railroad spike, driving through your skull every time your heart beats. You can't sleep, you can't think, you can't chew the 300 calories a day that are keeping you alive. And then the swelling starts. A soft, warm pillow of pus is blooming under your eye, and the pressure is pushing backward into your brain. The toothache that would have been a 20-minute chair time and a $100 bill is now a slow, agonizing countdown to septic shock, and there is no dentist, no surgeon, no antibiotic that can reach you in time. Most people will die from a bad molar in the apocalypse. You will not, because you fixed it last Tuesday. Subscribe so you never miss this. Stay for the final prevention. The one that costs $3, takes 30 seconds a day, and is the single most boring, most effective, most ignored health intervention in human history. The systemic lie is that dental care is cosmetic, that a toothache is just a nuisance you can power through. The mouth is not a separate compartment from the body. It's a bacteria-rich, blood-drenched gateway to your heart, your brain, and your airway. A dental abscess is a walled-off infection inside the rigid bone of your jaw. When that wall breaks, and it always breaks, the bacteria flood into the fascial spaces of your neck and face. Ludwig's angina, a swelling so severe it closes your throat, kills by suffocation. Cavernous sinus thrombosis, an infection that tracks backward along the nerves into the base of your brain, kills by sepsis and stroke. These are not medieval diseases. They happen right now in emergency rooms when people ignore a toothache for too long. In a grid-down world, there is no emergency room. The tooth is a ticking bomb, and the bomb is wired to your central nervous system. Number 1, the cavity. You are ignoring right now. You know the one. The dark spot on the lower left, the slight sensitivity to cold that you've been chewing around for 6 months. You told yourself you'd get it checked when things slow down at work. That cavity is a Streptococcus mutans colony that has already breached the enamel and is now dissolving the dentin layer underneath. It will not heal. It will not stay small. It will deepen until it reaches the pulp chamber, and once the nerve is exposed to bacteria, it dies, liquefies, and becomes a bacterial soup called pulp necrosis. A necrotic tooth is not just a dead tooth, it is an abscess waiting to happen. In peacetime, you get a root canal or an extraction. In the aftermath, you get a face full of pus and a fever that won't break. The time to fix that cavity is now. Walk into a dental school clinic, a sliding scale community health center, or a private dentist and pay the $150 for a small filling before it becomes a $2,000 root canal or a free funeral. Number 2, the deep crack you can't see. You clench your jaw when you sleep, you grind your teeth when you are stressed, and right now, the world is stress. A cracked tooth is a doorway for bacteria. The crack can be microscopic, a hairline fissure that extends from the chewing surface down toward the nerve. You bite down on something hard, a nut, a stale piece of hardtack, a piece of bone in a survival stew. And the tooth splits vertically. The pain is instant, electric, and the tooth is no longer salvageable. A split tooth must be extracted. In the field, with no anesthetic, a pair of pliers, and a partner holding your head still, an extraction is a bloody, brutal ordeal that leaves an open socket in your jaw. That socket can become a dry socket, an infection of the exposed bone, or a fracture of the mandible if the tooth shatters during the pull. The prevention is a night guard, a simple, molded plastic tray you wear while you sleep to stop the grinding. A custom one from a dentist costs $300 to $500. A boil and bite guard from a pharmacy costs $15 and does 70% of the same job. Do it now, before the apocalypse makes grinders of us all. Number 3, the gum disease that eats your jaw. Periodontitis is not just bleeding gums. It's a chronic, progressive inflammatory disease that destroys the bone supporting your teeth. The bacteria, Porphyromonas gingivalis chief among them, live in the pocket between your tooth and gum, and they secrete enzymes that dissolve the periodontal ligament. In a long-term survival scenario, your immune system is already stressed by malnutrition, cold, and sleep deprivation. Chronic periodontitis goes from a simmer to a boil. Your teeth loosen, the pockets deepen. You develop a periodontal abscess, a golf ball-sized swelling on the side of the gum that drains pus into your mouth for weeks and then tracks into the deep facial planes. The prevention is a dental cleaning every 6 months, which is impossible after the collapse, so you get one now. Then you floss, not just the week before a checkup. Every day, water flosser if you can, waxed string if you can't. Flossing removes the biofilm between teeth that the brush misses. It's the most effective, cheapest, most hated disease prevention on Earth. A box of floss costs $3 and will last you a year. The apocalypse will not have floss. Buy a 10-year supply. Number 4. The wisdom tooth waiting to strike. You are 30 years old and you still have your wisdom teeth. They haven't bothered you yet, so you figure you are one of the lucky ones. You are not. Impacted wisdom teeth, especially the lower third molars, are a time bomb. They sit partially erupted under a flap of gum called an operculum. That flap traps food, bacteria, and debris. Pericoronitis is the sudden, acute infection of that flap. It swells, it throbs, you cannot open your mouth, and the pain radiates to your ear. In a normal world, it's an emergency dental visit, a course of antibiotics, and a scheduled extraction. In a collapsed world, it's a throat infection that spreads to the retropharyngeal space, and you suffocate with a locked jaw and a neck full of pus. The prevention is surgical extraction now, while you still have an oral surgeon who uses sterile instruments and local anesthetic. If they recommend taking them out while you are young and healthy, say yes. The recovery is 2 weeks of soft food and ice packs. The alternative is a pair of pliers in a basement by candlelight. Number 5. The pain that destroys your judgment. This is the toothache kill chain that no one talks about. The infection hasn't killed you yet, but the pain has made you incapable of rational thought. You can't stand watch because you are curled in a fetal position. You can't negotiate with a hostile group because your face is a mask of agony. You can't eat, so your calorie deficit deepens and your electrolyte balance collapses. You make a bad decision. You take a risk you wouldn't normally take. You reveal your position to a patrol because you screamed when the cold air hit the exposed nerve. The toothache doesn't just kill you biologically, it kills you strategically. It turns you from an asset into a liability. And in a survival group, liabilities are eventually abandoned. Prevention is a dental first aid kit built before the collapse. A bottle of clove oil, which is eugenol, a topical anesthetic that numbs an exposed nerve, a temporary filling material like Cavit or Dentam that you pack into a lost filling cavity, a small bottle of oral lidocaine gel. These items cost $20 total, and they buy you weeks of functional consciousness when the tooth goes hot. The final prevention. The professional exam you schedule tomorrow morning. Stop reading and pick up your phone. Call a dentist. Say these exact words. I need a comprehensive exam, full mouth x-rays, and I want a written treatment plan for every single thing you find. Do not wait for pain. Pain means the problem is already advanced. An x-ray reveals the cavities between teeth that are invisible to the naked eye. It reveals the bone loss around your molars. It reveals the impacted wisdom teeth that are silently resorbing the roots of your second molars. A complete set of x-rays with a written diagnostic report is the single most valuable prepper document you will ever own. In a disaster scenario, if you can find a medic with basic dental training, that x-ray film and treatment plan tell them exactly which tooth is failing and how to extract it without shattering the root tips. The exam costs a couple $100. The information is priceless. Here is the reality. The dental industry and the toothpaste commercials will never tell you. The human mouth is a beautiful, complex bacteria management system that requires constant, boring maintenance. Before modern dentistry, dental abscesses were a leading cause of death in adults. We are talking about a time when a toothache killed roughly the same number of people as cholera. We have forgotten this because we live in a world where a dentist is a phone call away. That world is fragile. The grid can fail, the supply chain can break, the Novocaine can run out. But the tooth you fixed last month, the filling you placed, the wisdom tooth you removed, the floss you used this morning, that is permanent. That investment cannot be looted, hyperinflated, or erased by an EMP. Now, drop a comment and tell me this. When was your last dental checkup? Write the month and year. If it's been more than 12 months, write booking tomorrow. Then go online and find a dental school clinic in your area. If money is tight, they offer low-cost care by supervised students, and it's better than ignoring a bomb in your jaw. And in the next video, we are moving from the mouth to the eyes. The vision catastrophe that hits after 45 and the 3 pairs of glasses you need to stockpile before the optometrist is a memory. I'll see you there.